And good morning, everyone. I want to welcome you today to our session. It's titled Publishing, Policymaking, and Promotion, Expanding Your Research. And I thank you for joining us. I am recording today's session for those who are not able to attend. I'm Carly Michael Searcy. I'm Project Manager for ICU DDR, and we are the International Consortium of Universities for Drug Demand Reduction. And today's session came out of some work that we're doing at ICU DDR with 5 researchers who received NIDA-funded mini grants at the beginning of the year. And with these grants, our goal is to begin to address gaps in the research literature on substance use in low and middle income countries. And as we wrap up our work with those grantees, many of whom are on the call today, some questions came up that are relevant to a wider audience of researchers. So we're pleased to have so many people join us. We have time for presentations from 2 experts, and we've also left time at the end for a conversation based on your questions. I'm delighted to introduce our speakers. You may know Kim Johnson as our former ICU DDR Executive Director. She's a faculty member at University of South Florida, and she has a wealth of experience as a researcher and author. Every time I get the chance to talk with Kim, I learn something new, and I'm sure that will be the case today. We also welcome Matej Kosir, Director at Institute UTRIP. If you aren't familiar with UTRIP, it is a non-governmental, nonprofit research institute, and they conduct research. They develop, implement, monitor, and evaluate projects and programs in the fields of youth risk behavior, addiction prevention, health promotion, and healthy lifestyles. And Matej has been involved in more than 25 EU-funded projects. He's been a senior consultant for the World Bank Group in the field of alcohol policy and prevention. Kim and Matej, thank you so much for being with us to share your expertise. And Kim, I'll turn it over to you first.
Everybody, just a reminder, mute your mics because I can hear somebody talking in the background and you don't want us to hear anything that we might not want to hear. So welcome everybody. It's nice to see. I don't see any faces except for the speakers here, but it's nice to see your names and some familiar folks here. So I'm going to talk about a couple things really in line of how to extend your research and get access to research funding. Particularly aimed at the folks that were in that project and how to move their work forward from there. And I will talk about publication as part of that. So there are most of the funding for research comes from really 3 countries, although the EU as a group has some resources for, as Matej knows, some resources for work. The US, Australia, and the UK do a lot of research in alcohol and drug use prevention and treatment. And so those are the places where most of the work is done, most of particularly the English language research is published, and therefore most of our knowledge comes from. And so it's actually one of the things that we're quite aware of is that that's culturally biased, right? I mean, what happens in the US, Australia, and the UK is not necessarily what happens in the rest of the world. And so there is an interest in the high income countries to understand what is cultural in terms of both how their problem evolves and also how you solve the drug and alcohol problem, and what is not cultural, what is universal for everybody. And so there is interest in doing international research. My experience, of course, I'm from the United States, and so my experience is mostly from that perspective. And so I'm glad we have Matej, who has a European perspective and can give some different thoughts about that. So I'm going to talk mostly about the United States and English language publications and how to work in that environment. The United States has 3 primary funders of research around alcohol, well, 4, I'll say 4 primary funders of research around alcohol and drug use. And the biggest one is our NIDA, the National Institute for Drug Abuse, and NIAAA, which does alcohol. It still has the name alcoholism in its title. under the National Institute of Health setting. And they fund most of the research, but they actually fund very little internationally. And to access their funds internationally, primarily you have to work with a US-based researcher who then can access resources that can engage international scientists with their own work. And then the other two agencies are the CDC, whose work is primarily focused around HIV and its interaction with alcohol and the higher risk group of people who use drugs, and in some countries with alcohol. And USAID, which funds some very big grants internationally, and its whole purpose is to fund international work. So that's where the resources are, and the way to access those resources is really primarily through people, and that's why the project that we had tried to link everybody with a researcher who had similar interests in the United States, because it helps them and it helps you so it helps them to extend their work and access international resources. So that was the goal of that particular project, that to link the researchers in low middle income countries with researchers in the United States that were doing similar work, so that with the goal of extending that, not just this little project, but to create that relationship so that you could conduct research together in the future. And hopefully that worked out for some of you, because I think that's probably the best way to extend your research from the projects that you had is by working with that same scientist mentor going in the future and publishing your work with them. If that didn't work out, there are a couple other ways of making connections that I think are important. And one is just to link with authors of works in your field that you admire, that you're citing in your own work. Usually in publications, it will have a contact and you can just email people. And it's sort of funny, most of us are shy about reaching out to people. And I think Matteo will say the same thing when he talks about advocacy. People mostly are flattered when you contact them and express interest in their work. And so you should not be shy about sending an email and asking questions or commenting on their work, and trying to develop a relationship, even just through that kind of process around with particular authors, because they may very well, they'll be flattered for sure. And they also you may develop a relationship that could become a working relationship. They may be interested in the work that you're doing and figuring out how to engage with you. So that's another way. The third way is conferences. And conferences, of course, are expensive and you have to figure out how to get there. And one conference, of course, is the ICU-DDR conference. And I, of course, recommend going to that, or the ISIP conference. But another conference I would recommend, and ICU-DDR has in the past supported a handful of people going to this conference, is the College on Problems of Drug Dependence, the CPDD conference, that's funded partially anyway by NIDA. And NIDA funds some international travel, and at some points in time, ICU-DDR has funded travel. And so it's worth looking into that, because that is where a lot of American scientists who are interested in doing international work may congregate. And there's an international portion of that conference, and it's usually in June. So that's another place to really meet people, learn about their work. And again, when you give a presentation at a conference, if nobody comes up to talk to you afterwards, it's very discouraging, right? You think, oh, I didn't connect with the audience at all. So please go up and talk to the speakers that have said something that that interests you or that is in line with your work, because that's a great way to meet people, get those connections with scientists that may have access to resources, and learn more about their work and get to know them and share your own work. So those are just a few really kind of simple, basic ways to connect with people who have access to resources in higher income countries. And it's sort of surprising, I think, how hungry we all are as scientists to have other people recognize and understand and read our work, because for the most part, researchers have not really publicized their work outside of their peer-reviewed publications, right? It's a very narrow focus on how we gain in academia, how we gain recognition, and so people are flattered when someone actually has read their papers or is interested in their work. So then what's the process? So let's say you've made a connection, you have someone who you're interested in working in. The process of accessing funds is a little bit random, I have to say. I have colleagues that are well funded, have lots of research published, and they're still surprised by how random it feels whether you get funded or not. But there is a standard process that you have to go through, and the first one is publishing your preliminary research, right? So that's a critically important thing. So there's a process, a standard process for getting your work out there. The first thing is doing some sort of small preliminary study to see, it's a feasibility study, and I think that's what everybody in the project did, was a feasibility study to see, is there some justification for expanding on this study. And having your feasibility study published in a peer review publication is critically important. I mean, sometimes you can do a presentation at a conference and that will get in some conferences that gets published. And so that would also count as a publication, but you really have to have some work published in order to get a bigger study funded. And so I think many of you that were in the project took the publication course that ICDD offered, and others of you, I would recommend that. I'm sure it will be offered again sometime over the course of this year. It's publication in peer-reviewed journals is a very sort of formulaic process. And taking that course will kind of walk you through the formula of how to write a paper so that it can get published in a peer-reviewed journal. And so I'm not going to talk about all that because it will take too much time, and there's a whole course that ICDDR offers on that. But just to say that it's a formulaic process, you have to get published in order to move your research forward. And each journal has its own quirks, and you have to read their author instructions very carefully. And follow them. And then I guess the one other thing I'll say is, so if it gets accepted for peer review, you have to respond to the peer reviewers. I have a paper right now that is on prevention, actually, and it's been a long time. It's been a long process, I'll say that too. It can take up to a year to get a paper from the point of submission to actual publication. And this one that we have right now, we thought we responded to the peer reviewers' comments, and they came back and basically said, you didn't respond to our comments and you need to make all these changes. And so now we're going to do it again. I have as a peer reviewer reviewed the same paper 3 or 4 times before it was ready for publication. So you have to really try to accept that and respond to those comments. The last thing I'll say about this whole process of getting grant funds and how you move your research forward is who. It's hard to get funded if you have never published with the other people that you're working on your grant with. So one of the sort of standard things that we do in the United States anyway is if we know we want to work with someone, we make sure that we have some kind of a publication that has us as joint authors, because that's the indication that you've worked together. And so so as you're thinking about, okay, I have this person that has access to resources who I'm interested in working with, they're interested in working with me, that sort of preliminary research, whatever it is, preliminary study, make sure that you are all authors on that paper. So that there's evidence that you have worked together, because going forward and trying to access resources, that will be a question that comes up. And it's sometimes, particularly with NIH grants in the United States, that's sometimes the differentiator between a good score and a bad one. So I think I covered everything that I intended to cover. Hopefully it's what you were interested in. And when we get to the questions part, I'll be happy to answer some questions.
Matej?
Just a minute, not a minute, but 10 seconds to share the screen.
We can see it,
right?
We just
Yeah.
Okay. I will speak a little bit about advocacy and the importance of advocacy also for researchers, because in many cases we forget that researchers and scientists could also be an important stakeholders in advocacy campaigns. Of course, it is a natural role of non-governmental organizations or non-profit organizations, but we know from our experience that without the support of researchers and scientists, with all the data and scientific findings, we cannot be really successful in the political arena. Because, you know, we always struggle with different interests, a lot of conflicts of interest as well in policies also related to addiction, especially related to alcohol and tobacco policy, and cannabis policy is becoming also a huge issue, and a lot of conflicts of interest among different stakeholders in the field. So researchers and scientists should become much more important in this advocacy work as they are at the moment, or they used to be in the past. So I will talk about a little about this topic, and maybe highlight some important issues. It's too short time to present everything, but hopefully I can present at least the most important stuff. So why advocacy is so important? And we know that from a long time ago, especially if you look at the situation in the field of tobacco, for example, 50 or 40 years ago, where we were at that time and where we are now with all the advocacy efforts and support from science in the field of smoking and tobacco use. So you can imagine that everything is possible in the long term. Also, the most impossible things are possible in certain time, in certain period of time. So also knowledge and skills, how to do advocacy is a crucial issue, of course. They're becoming more and more essential for addiction scientists, researchers, practitioners to potentially influence all kind of policy and decision-making processes at all levels, no matter of the, you know, policy level, practice level, funding level, research, education and training programs level. So all those questions are extremely important to be involved with advocacy campaigns. And advocacy skills are especially important, as I mentioned already, especially in public health areas where so-called unhealthy industries are influential, or at least they want to be influential and important stakeholders in the field, such as gambling industry, alcohol or tobacco industry, cannabis industry, also junk food industry or pharma industry as well in some cases. This is just to give you one example how alcohol industry network looks like in Brussels at the European Union level. This is a situation we have been facing in the last 2 decades in Brussels. We are maybe only few public health organizations there with our representatives and offices in Brussels, communicating, collaborating with EU institutions and the Parliament and the members of the European Parliament, members of the Commission. But this is the network of alcohol industry. They have a lot of different stakeholders, not just the business stakeholders, but also so-called research stakeholders. They have their own research institutions. They collaborate with a lot of high-level and very respectful universities in the world. They have their own, I don't know how to say, non-governmental organizations as well. Different trade unions, different marketing-related organizations, etc. And they are there every day, 8 or 10, 12 hours a day, communicating with European Union relevant stakeholders. And you can imagine my last number I got from our colleagues from Brussels is that there is approximately 500 to 600 people in Brussels and Luxembourg working for alcohol and tobacco industry. So you can imagine the pressure and the situation we are facing every day while we try to influence with our advocacy efforts towards European addiction, alcohol, tobacco, cannabis, or other policies. So this is the reality we have to live in and try to find a way to avoid this kind of unhealthy influences. So together, I would say, as a coalition, we can build a stronger relationship with policy and decision makers. This is all what is, I would say, one of the most important issues in advocacy, forging stronger relationships with policy and decision makers. In many cases, you know, you would not imagine, just as an example, I was present today at the meeting with a minister of public administration. She used to be a part of civil society before she became a minister. And many people from our group of civil society organizations have personal contacts already from before with the present minister. So you never know what might happen in political arena. Maybe some of our colleagues will become important policy and decision makers, and it will be much easier then to collaborate and communicate with them. So building this stronger relationship with them, it's extremely important also for all our future advocacy activities. Also advocating for the use of research to inform policy and decision making. We sometimes forget about this important issue because research is mostly, I would say 99% on our side. So we have to use this research more often, more frequently, more strategically in our communication with policy and decision makers. Of course, industry, like business stakeholders will also say that they're using research, but only minor research is on their side. And in most of the cases, this kind of research is usually funded by unhealthy industry. So it's a conflict of interest again. Then with learning how to do advocacy with practice, with trainings, we can also learn how to provide expert testimony, for example, in the parliament, which might more often happen in Europe than in the United States. I know that in the United States it's a much more complicated system, but there are also ways how to influence and how to come to speak in front of the Congress or some other institutions in the United States or in some other countries in Africa, Asia, or elsewhere. Also, with the good knowledge and skills in advocacy, we can write superb position papers with a lot of good arguments, press releases which can be recognized by different media, social media posts. It's becoming extremely important also how to do advocacy work in social media. Organizing quality and well-attended press conferences. This is also an important issue if we want to attract media, of course, to have published articles and news in the traditional media like TV or radio. Also, it is very important that we increase visibility and recognition of evidence-based addiction-related policies and practices, and to repeat over and over again what is evidence-based and why evidence is important, so we can achieve much better outcomes in the future. Also, committing to ongoing advocacy is very important. At the beginning of my career, I thought that advocacy would not be even 1% of my work. But nowadays, I have to admit that I would say 50% of my work is dedicated to advocacy. Because whatever we produce, whatever we want to achieve in the field of prevention, because I'm more involved in prevention activities, policies, and practices, or we want to achieve more advocacy work is needed to do it. This is a very simple policy cycle, and it is very important to know how strongly we can influence different phases of policy and decision-making processes. And usually what we most often do, we enter these activities too late, where some policies are already adopted by different interministerial bodies or ministries, or sometimes even the government already decided about something. And then we jump into this process in media, we organize press conferences, but more or less, the most important decisions are already made, and we have no power or very little power to change maybe some little things, but not some major decisions. And also sometimes, which is also quite often, we enter this advocacy arena even later, like when some legislation is already adopted by the parliament, is already started to be implemented, and then we notice this somehow, and we start jumping to the sky and shouting, etc. Too late. So we have a lot of different opportunities to start this process much earlier, to contact maybe political parties in advance before elections, when they start to develop, for example, pre-election programs, to try to use our arguments, so they adopt our arguments and put them into the pre-election programs. So they promise to the voters something which we advocated for, and this is much better. We have much better chances to be successful in the long term, because if this is written somewhere in the political program or a coalition agreement, if you have a coalition government like in Slovenia, if it is written already in the coalition agreement, then you always have a chance to mention or to remind them about their promises, and you have much bigger chances that those kind of promises will be actually put in place in practice and in policies, than if you are not doing this. Also, policy formulation is very often depends on the political system, how civil society organizations or people from universities can be involved in some intersectoral, interministerial, or some other work, where those working groups decide about some key decisions, key legislation, key strategic documents and policies, before those documents become documents in the real decision-making process in the parliament or within the government. So those two phases are much more important and could be much more effective if we are entering this advocacy campaign much earlier. Also, evaluation is sometimes crucial because, you know, politicians like to change legislation quite often, depending on their interest. If they see they did some mistake, I would say mistake, they try to change it quite quickly. So it's also important that we monitor the implementation of legislation and all related policy and decision-making processes related to specific policy or practice. So this is also very important to be present in this phase of policy cycle. Coalitions, of course, we cannot do it by ourselves. We are not a huge global influencers like Kim Kardashian or Bono or Sting or Leonardo DiCaprio. We don't have direct access to the most important politicians in the world. So we have to create efficient, effective coalition. So we need to gather more people, more relevant people together so we can be more successful in the long term. And we have to decide in advance on behaving and working corporately, because this could be a huge problem sometimes, especially if we don't share the same interest or purpose of our work. So this might be really a nightmare if you enter a coalition with somebody who has completely different opinion or objectives like your organization. So be careful with this. As I mentioned, advocacy is a kind of natural role of civil society organizations for ages. But as I said, equally important is that researchers and other professionals are involved in advocacy work and as a members of coalitions as well. We can also invite media to be our partners in advocacy campaigns. If we know any journalists, they could be really helpful. They know the channels, how to provide information, how to reach the audience, how to attract media. They know how to do it. So if we can get somebody who is well equipped with the knowledge and skills, how to deal with media, excellent. Make him or her a member of the coalition. Also, in some cases, we can involve some of policy and decision makers as well. Especially, for example, in alcohol policy, it's not just health issue. You know, it's also agriculture issue, it's also a financial issue, it's also a business issue, economy issue. There are a lot of issues, a lot of areas which alcohol policy could be involved in. So if we deal with the Ministry of Finance to increase the excise duties, for example, we can invite some policymakers from Ministry of Health to be our partners in advocacy coalitions as well. Maybe some, also there's several benefits or disadvantages of coalitions, but I will actually leave it here to you so you can read them to save some time and for questions and answers. So we can maybe mention also some of other important issues like media advocacy shortly. So you see, those are disadvantages. Quite often, they might happen quite often. Also, I'm telling you this from my own experience of more than 20 years of advocacy work. And media advocacy, one of the most important parts of advocacy work. So you can see this quote, and it is true. If we don't exist in media, we don't exist. No matter what we do as a researchers, what excellent findings we can get from our research and studies, if we don't publish it, not just in scientific papers, also in other, maybe more traditional media, we don't exist. Nobody will see or hear about our findings, except some scientists and researchers. Also, social media is becoming, I told you already, more and more important. So if we are not in social media, we also don't exist. So we have to use social media as well more often. So to reach more media coverage, we need a good media plan and good message. So it's worth to take some more time to create good, effective, maybe also provocative messages to reach better media coverage and also reach attention of policy and decision makers through media. So those are the most often and using methods of media advocacy, like press releases, web blogs, interviews, TV, radio discussions, press conferences, and social media posts. There are some others as well. And there will always be successes and failures, some bigger, some smaller. We have to live with that. Life of advocate is it's not always nice. It's funny to be advocate. There are a lot of nice and funny moments, but there are also failures. And we have to be persistent and committed to our work and wait for another window of opportunity to make failure a success. So I hope you enjoyed this presentation, took some good hints and tips how to do advocacy work, and I wish you a lot of success with your advocacy efforts and work. Thank you.
Thank you, Mate. That was very helpful. We've had some discussion in the chat. So now that we're done with presentations, let's go ahead and open it up. If folks have a question, please go ahead and unmute and ask your question about research, advocacy, publishing, those topics. And by the way, if you are in the chat and you see Mulvey K, that's Kim. She just has an unusual name attached to her today. So she responded to a question from one of our folks. Thank you, Deanna, for the positive feedback.
While people are thinking about questions, I just thought I'd add something to what Mate was saying, that while research needs to inform advocacy, there's actually a whole brand of research that is around what is effective advocacy strategies, right? So thinking about how there's both the implementation science perspective in terms of what works in terms of implementing whatever in your organization or your community or your country, but then also what is effective in terms of policy and advocacy for policy. And that's another whole area of research. And so a lot of people don't think about those kinds of research, but they're actually things that that funders are actually interested in, right? Like, how do we get the big problem now from the US research's perspective is, well, we have all these prevention practices, we have all these treatments that have been demonstrated to be effective in clinical trials, but nobody uses them. Nobody uses them in the United States, nobody uses them in other countries. Why is that? What is it about that process of going from research to practice that makes it so that it doesn't happen? And policy has a lot to do with that. And so understanding policy from a research perspective, and both how to change it, but then also what its effects are in terms of the ability to use research or evidence-based practices, is a whole area of research that really lends itself to cross-cultural, cross-country work, right? And not many people think about that, think about work, particularly in addictions, from that perspective. So if you're sort of floundering for what your research career could be, that's something to think about, is implementation science, and then also policy research and its impact on the ability to provide care for people with substance use disorders.
Thank you, Kim. One of our participants said, thank you, Mate, that social media advocacy has been very powerful in Nigeria. And he is the person who's one of our NIDA researchers who asked the question about advocacy. So I'm glad to know that your presentation helped answer some questions. Any other questions?
Hi, thank you, both of you. They were excellent, really. They were so easy to follow your presentation and practical ideas that we all seem to know about. But when you see it all together and just as you presented, especially in the case of Kim, that was a refresh. So thank you. And the presentation of Mate, absolutely agree with everything. Now, it's more like a comment in countries like ours in South America, where we don't have clear policies about advocacy, about the implementation of the laws. I don't know if you heard about this, but a while ago, our ex-president, one of our former presidents of the nation, was declared significantly corrupted by the government of the U.S. Then the current vice president was significant corrupted, and the former president is known by having a big factory of cigarettes and sending their cigarettes all over South America and probably North America. Who knows? I don't know. Probably South America. So in countries like this, it's very difficult where these guys also are the owners of the media, of the journals. So what kind of policy would they have against their own interest? None. So it's difficult to have this kind of situation. But I absolutely agree that we that work in the field should not get tired of kind of knocking the door and saying, hey, this is important, this is the way it should go. And the same with the research. In the time that we produce more research and we can publish, we don't have as many opportunities, like universities don't support much, and we don't have national agencies like you guys have, like King was mentioning, the NIDA and IHA and all of those. So it's difficult for us. So this was coalitions, as Matej was mentioning, are good opportunities to partner with people that are doing in high income countries that will give us a little space and opportunity to show our work, and maybe from there then sometime in the future get our government or government and governors to take a look at it more seriously. There are people that are serious about the business, so only that they don't have the power, the economical resources, and the power to put the topic in the agenda, in the political agenda. So that's a big concern that I have in our side.
Mate, do you want to comment on advocacy in a difficult environment, or
That's why I mentioned, and I was serious about it, that it's a long-term commitment. Advocacy is not ad hoc activity. Could be sometimes as well, could be also successful as ad hoc activity, but usually and most often is ongoing activity, ongoing work. We should be committed, persistent, patient sometimes, because things in politics change every 4 years. If not in 4 years, then in every 8 years, for example. So we have to wait sometimes a little bit for those kind of windows of opportunity. And when they come, we have to be ready. Not just searching for our documents and trying to figure out what to do, but we have to be ready when the time comes to jump into one or another topic. So that's why coalitions are important, because coalitions usually produce a lot of useful materials, some guidelines, some legislation proposals, and so on. And all those materials can wait for the right moment in the future. So it's important really to be ready when any window of opportunity comes on our path.
And I think we don't want to underestimate the difficulty of trying to do this work in countries where the government is either corrupt or repressive, or right. I mean, I think that's a reality for many people, and as Matej said, is being prepared and being ready, and if it's possible, to work with, particularly as researchers and scientists, to work with. Again, this is a time when working with people from other countries, if you are able to, is really important, because if your own environment is not going to support you, is there a way that you can connect your work with an environment that is more supportive, right? So that it can still carry on. But in a lot of places, it's very difficult and nearly impossible. And I think we need to recognize that. But I will say, even in the United States, sometimes we run into these kinds of scenarios where a senior government official, whether it's in the federal government or in a state government, is aligned with industry that sells alcohol or tobacco, or I mean that is not uncommon. And so, as Matej says, it's sometimes you just prepare and wait. It is very hard to or in a democracy, there are other forces at play too. So, I mean, there are ways of managing that, but there are many different forms of government, and sometimes you can't.
Most of politicians want to be re-elected. So if we can get media or voters on our side, that might be a game changer.
Yes, where there are elections, that's important. Yeah.
Good. Interesting comment in the chat, and it's from Dr. Manda, and she says that they've been successful in working with the Bureau of Corrections, but the challenge is establishing sustainability because there's constant changes in administration. And so Matej said, be ready for the opportunity, and she's reminding us of the flip side of that, right? When things change, sometimes it interrupts work that's been done. So I didn't know if either of you had any comments about that.
That's one of the, speaking as an implementation science researcher, that's one of the things that are the most interest from the perspective of implementation science, is how do you embed whatever it is into an organization or a system, such that those leadership changes don't make it not happen anymore. But it's really, you're right, it's really hard. Leadership priorities change. I mean, even working for the United States federal government, when we elect a new president, the priorities change, and everybody that works in government goes, "Ooh," like it's just and so that is a reality, right? That it all changes. And so one of the things to think about is, are there ways that you can embed things systemically so that that sort of political change doesn't impact it? And it sort of depends, but I think things that have standardized, if you can have standardized protocols and processes that that don't require that much thought or interaction of a person, because people are going to change, right? We're going to look at our boss and do what our boss wants. But if it's just like, this is the process, that seems to actually, and if it's written in policy and in the organization or the system, and it's the standardized process that's routine, that seems to be the way to embed things in a way that that they don't change just automatically with leadership, and leadership has to actually put attention to them to make them change. So that's the thing that's happening that we're looking at in research from an implementation perspective is how do you make things sustainable regardless of that leadership change?
Another important issue, because we still have time to discuss a little bit, that sometimes we are too ambitious with our objectives and goals. We want to change the whole, for example, alcohol policy. But it is a much better strategy to go step by step. The government or authorities might not be in favor to change some of aspects of alcohol policy, for example, some financial aspects like excise duties or taxes, marketing, etc. But they are maybe willing to change and improve some drink and driving legislation, or maybe some, I don't know, primary healthcare regulation to involve more drunk drivers into the primary care, healthcare, and so on. So there might be an opportunities, no matter of the resistance, political resistance in one or another policy. So that's the smart thing to do as advocate, to find those opportunities, no matter of the political background of the present people in power, and try to find those opportunities. There might be 1, 2, or 3, and then when you discover them, go for it, and forget too ambitious goals.
Can I just say something? Yeah, so I'm Charles from Nigeria. So there is this approach that somehow works for us in Nigeria when we find a policy or something going wrong with the system. Sometimes it's corruption. What we ask is who is affected by this corruption? So if it is on drugs, if it is on crime, if it is people stealing money from government, we ask as researchers, who are those who are most affected by this problem? If they are students, if they are patients, if they are any group, we then take the information to them and tell them, this is how this problem is affecting you. And this is the evidence that this problem is affecting you. And because the group, maybe a group of students, maybe a group of people, even in another business, but they are being affected by a bad policy, but they don't have an awareness of evidence to show that this is a problem and is really affecting business. So when we take the information to them, they now take the fight up. Somehow it covers you if you feel that you are threatened. But these people who are an organized group as well takes the evidence and begins to campaign and push and advocate for change. I just want to share the experience we have in Nigeria.
I think that's really important and interesting to think about for anyone that's doing advocacy, right? Is who's impacted and how do you get those people to advocate for themselves, rather than having, and you know, that may be through the coalitions or some other way. But yeah, I think that's a really good point.
I strongly agree with Kim. If they go to advocate by themselves, like students or patients, they might not be successful. In a way, like wider coalition of patients, students, researchers, civil society organizations come to be louder in media and also in communication with political institutions. So that's the power of coalitions. So you gather more power together, and sooner or later they will have to listen to you.
When I was involved in state government advocacy, the trick that we always used was we would have the data, we would have the scientific data, just a few very important bullet points, and then when we would bring the people that were affected to speak to the legislature to advocate for or against whatever the thing was, whatever the bill was. And the idea was that the data, I mean, in our minds, the stories supported the data, but really the real story is the data supports the stories. The stories tell the legislators what the impact of their policy or their potential policy is, and the data just says, and this one story is represented by these hundreds, thousands, millions of other people, right? And so there's at least in state government in the United States, there's sort of a formula for presenting your argument to leadership, and it really is that here's the story to try to get them engaged in that person's story, and here's the data that says this one story is actually 1,000 stories.
Great point. We've got just 3 minutes left, so we would be able to take one more question if we have one from the audience. Okay, seeing no open mics, I want to thank you both, Kim and Mate, so much for the great information, and I want to thank our participants as well. Charles, who made me think about advocacy as a bottom-up strategy, not just the top-down. That was very helpful. I appreciate you all very much. If you will hear from me, because I'm going to send you a link to today's recording. I'm going to send you Mate's slides as well, and that way you'll have my contact information. So if there's any way we can connect with you at ICU DDR, we want to do that. So please reach out. Thank you so much, everyone. Be well.
Bye.